Hello everyone. In this brief video, we are going to address the differences between type 1 and type 2 diabetes. I am Dr. Hassan, Dr. Khalid Hassan, Associate Professor of Clinical Pharmacology and Drug Therapy. So, what are the differences between type 1 and type 2 diabetes? Diabetes defined as a metabolic dysfunction marked by persistent elevation of blood glucose, and this will lead to the irregularities of in carbohydrate, fat, and protein metabolism. Patient may suffer from classic symptoms, but we have more symptoms like polydipsia, like polyphagia, and polyuria. So for regarding the symptoms here, polydipsia mean excessive or abnormal thirst. Polyphagia, patients suffer from excessive appetite or eating. Polyuria, patients suffer from excessive secretion or urine. So going to the bathroom a lot during day and night, patient may suffer from blurred vision and fatigue. So here, if the patient left untreated, the patient may suffer from complication or consequences. This may include acute complications that require emergency treatment, such as diabetic ketoacidosis or hyperosmolar hyperglycemic syndrome. So we have two emergency cases: diabetic ketoacidosis or hyperglycemic syndrome. On the long-term complications, we call this one chronic complications. The patients are suffering from chronic symptoms such as retinopathy, nephropathy, neuropathy. Retinopathy that affect the eye, and the patient may suffer from maybe impaired vision. Nephropathy, decreased kidney function. Neuropathy, maybe the patient may suffer from tingling, numbness, and their extremities. Regarding the macrovascular complications, this mainly affect the large vessels. Here we talk about coronary arteries that may be responsible for providing blood flow to the heart. Then we have peripheral arteries that goes to the extremities, and this could be responsible for gangrene if we have any disease or like any impact pathological change in the peripheral artery. This will lead to gangrene. So for classification of type 2 diabetes, classification of diabetes, we have type 1, type 2, gestational diabetes have occurred during pregnancy, and we have another one called MODY or genetic syndrome. And you can see the genetic syndrome 1 to 2%, type 1 diabetes 5 to 10%, type 2 diabetes, the majority of diabetes belong to the type 2 diabetes of 90 to 95%. The question now, what are the differences between type 2 and type 1 diabetes? I will start with type 1 diabetes. As you can see here, type 1 diabetes occur by that 5 to 10%, comparison with the type 2 diabetes, 90 or 95% of people suffer from type 2 diabetes. So if you have 100 patients coming to the clinic suffer from diabetes, you are going to see 10 patients from type 1 diabetes, but maybe most of the patients will come related to the type 2 diabetes. Type 1 diabetes mainly happen in young children and adolescents. Patient normally thin or like they have normal weight, mainly related to the autoimmune disease. This will lead to the destruction of pancreatic beta cells, and the patient here has no insulin. So patient has no insulin. The treatment here will be insulin only. Regarding the type 2 diabetes, the patient age maybe 40 years and above, and the patient here suffer from some kind of obesity, The tissues maybe demonstrate insulin resistance, cells and tissue, and or decrease insulin secretion. Some study showed the decreased incretin effect, and the last one maybe talk about upregulation of sodium glucose transporter in the kidneys. So this compare between type 1 and type 2 diabetes. Okay, regarding the treatment, you can see here type 1 diabetes, because we have no insulin, the patient need insulin. For type 2 diabetes, okay, we have decreased secretion of insulin, or increased resistance to the insulin. So the result will be healthy diet, increased exercise. We have hypoglycemic agent, could be oral, could be injectable. If we need more details, I have the entire lecture about diabetes. I refer you to this lecture for more information about hypoglycemic agent. At the end, the patient may need insulin injection. So at the beginning here, for example, for the lifespan, the newly diagnosed patient, and this is after 15 years of the disease, the patient in this, for example, time may need the insulin. But in the beginning, we can start with metformin, for example. We can start with empagliflozin, or we can start with some other medications such as sulfonylurea. So we have several options before the patient situation deteriorated and the patient need the insulin here. Okay, this slide here represents the pathophysiology of type 2 diabetes. We have two main organs involved in type 2 diabetes, the liver, and you can see here the liver will start producing glucose. Okay, so the liver produces glucose, but what we have here, the tissues and peripheral tissues such as muscles and adipose tissue unable to take the glucose. So the glucose unable to move from the blood to the organs or to the cells, unable to move. So with what we call this process increase insulin resistance, increase peripheral tissue insulin resistance. So this is the one maybe possible theories. Another theory is about type 2 diabetes, like decreased insulin secretion. So the pancreatic cells demonstrate decreased secretion of insulin. So we have decreased secretion or increased resistance. So this is a main mechanism, but we have other mechanism already mentioned in the previous slide. How we can diagnose a patient with diabetes. This one here, the criteria for diagnosis of diabetes mellitus: glucosated hemoglobin A1C more than 6.5, fasting blood glucose more or equal 126 milligram per deciliter, 2-hour fasting glucose more than 200 milligram per deciliter, and random blood glucose more than 200 milligram per deciliter. This one in general, but if you need to maybe to look on this data in details, you can see here we have differentiate maybe the differences between two societies. For example, if we discuss about American Diabetes Association compare with the American Association of Clinical Endocrinologists, they have different range for the A1C, fasting glucose, and peak prandial glucose. Okay, thank you so much for listening, and have a great day, everyone.